Hey guys, today I'm going to talk about teamwork in autism. So, teamwork here means multidisciplinary team. I know. What is multidisciplinary team? I will explain you. So, a group of team members, a group of different professionals, when they work together for a specific set of goals, for the kid with autism, we say that we are using multidisciplinary approach to bring about the changes, bring out about the improvement in your child to be successful in daily living activities. I just give you one example. If a child is coming for occupational therapy treatment, and during the occupational therapy treatment, if I myself observe that the child is having deficit in speech, language communication, or having different behavioral issues, definitely I would like to involve my team members into my occupational therapy sessions. And the reason is very simple, that parents have this awareness that what is a speech therapy. They never ask me what is a speech therapy, but whenever I use the word behavior therapy or applied behavior therapy, they got confused because they usually ask what is occupational therapy, what is behavior therapy. So occupational therapy, you can just click down in the description box, there is a link. I have spoken about occupational therapy and how it works in autism. As far as behavior therapy is concerned, it is the approach to behavior that is involved to increase skill acquisition and decrease the challenging behavior in your child with autism. I want to make it more clear to you. I'll give one example. If a child is coming for occupational therapy because of difficulty in sensory level of the child, or because of motor coordination, because of deficit in self-regulation. So whenever I'm treating the child through the different occupational therapy activities, if a behavior therapist will observe those sessions from my team, or if a speech therapist could add something after the observation of occupational therapy sessions and the interview by the parent, then they could really help me to get the better improvement and result for my child. So what behavior therapist usually does during the occupational therapy sessions, behavior therapist observe and take the history from the parent, and then try to find out the root cause of the particular behavior because of which maybe occupational therapy is not going so well. So after getting that root cause, behavior therapists create the environment to decrease that behavior, and thus it will help the child to move forward as far as their communication skills are concerned, social interaction is concerned, their speech skills are concerned. The same thing is applied for speech therapy sessions as well as behavior therapy sessions, because many times my colleagues, my team members are coming to me that the child is not cooperating, is having less sitting tolerance during the speech therapy, during the behavior therapies. So I can just give one example, like bouncing on a therapy ball. This activity gives a vestibular and proprioceptive stimulus to your child. So I usually help my team members by recommending them to use that ball during their behavior therapy session when they are trying to work towards their sitting tolerance, or use of that therapy ball, so that it will calm the child, and thus child will be able to focus more during the speech therapy sessions and behavior therapy sessions. So my dear friends, I want to tell that all these therapies complement each other. Although I agree that occupational therapy, speech therapy, behavior therapy, all three overlap sometimes to some extent, but different therapists definitely give different results when they collaborate together to bring about the positive change in your child for the successful development in his daily routine activities. So, today we have a parent here who is willing to share about his son's improvement through the effort of multidisciplinary team. So, to you.
Hi everyone. I thank Dr. Priyanka for giving me an opportunity to share my experience on her channel, and I would like to inform that my wife has approached her for occupational therapy and speech therapy for my son. As we were continuing with occupational therapy and speech therapy, and we were continuing it for the time, but later we did not notice much changes in my child. We were not satisfied with it. So the Dr. Priyanka, they had called a behavior therapy specialist who observed that my son is having some behavior issue. So they helped us in correcting that issue. So later on we started with behavior therapy as well, and hence now we observed that my wife has informed me, actually I don't live here, my wife informed me that there are a lot of changes in my son's behavior. So when I returned, I saw my child, he was completely different, and now we are happy. Occupational therapy is and speech therapy, they are different, but combine all three will give a very good result, and I have noticed in my child. Dr. Priyanka's advice she had given us 3 months back. We followed it, and today we are happy, and there is a lot of change in my son, and in his behavior. It's unbelievable for us, and we thank them for the support.
Thank you so much, sir.
My pleasure.